Hello dear students, today we will be discussing regarding hematological disorders. So unit 12 is regarding hematological disorders, and in that particular unit the first disease condition which we want to discuss is anemia, and today in this class we will be discussing about anemia. The term anemia is very familiar for all of you. But the meaning, it is originated from ancient Greek words, that is anemia. An means without and emia means blood. So they were considering that anemia, it is a lack of blood or reduced amount of blood. In the picture itself, it is very clear. When you are comparing a normal and anemic person, the red blood cell will be markedly reduced in an anemic patient. Next we can see the definition of anemia. It describes the condition in which the number of red blood cells or the hemoglobin concentration is reduced below normal values for age. So when you are reading this definition, there are importantly 3 points you have to understand. So the anemia, it can be the reduction of RBC, that is the first point. The second point is it can be the reduction of hemoglobin concentration. But you have to refer the normal values of the particular person's according to the age of the person. So the pediatrics and in an adult person, the normal values will be varying. So according to the normal value, we have to find whether it is normal or abnormal according to the age of the person. So that is the definition of anemia. It describes the condition in which the number of red blood cells or the hemoglobin concentration is reduced below normal values for age. So what is the role of this RBC and hemoglobin in our body? It's very well studied in previous classes, but just as a revision, we can see the red blood cell will be taking up oxygen from lungs, and this oxygen in RBC, it gets bonded with the hemoglobin and it is carried to the necessary area or the tissue cells where there is a need of oxygen. It will be released to that particular tissue cells. So the carrying capacity of the red blood cell is determined by the hemoglobin concentration. Oxygen carrying capacity is determined by the hemoglobin concentration, and also the RBC is carrying the oxygen. So that is the role of RBC and hemoglobin in our body. So when there is a reduction, there is a decrease in the oxygen carrying capacity of the blood is diminished, causing a reduction in the oxygen available to the tissue. So the transportation capacity is decreased and the available oxygen in the tissues is decreased. Regarding the incidence of anemia, this is the most frequently occurring blood disorder. Anemia prevalence in young children remain over 70% in most parts of India and Asia. Regarding the etiology of anemia, anemia can be caused by many things, but generally 3 main body mechanisms are responsible for the production of anemia. So the first reason is excessive destruction of RBC. The second reason is blood loss. And the third reason is inadequate production of RBC. So these are the 3 main mechanisms that predispose in the anemia. Next we can see the classification of anemia. Various classifications are there in relation to anemia. The first classification what we are discussing now is on the basis of etiology and RBC morphology. So the first type of or the particular etiology or based on the etiology, the first type is disorders of impaired RBC production. So the type of anemia which is coming in that particular first category, impaired RBC production, because of RBC production, that is deficiency anemia. For example, iron deficiency anemia is coming under that. Nutritional megaloblastic anemia, mixed deficiency states. So these all conditions can lead to anemia because of impaired RBC production. And the second category of disorders which is coming in the impaired RBC production is the bone marrow failure. So the bone marrow failure, it can be because of aplastic anemia, selective red cell aplasia, and acute lymphocytic leukemia. So these conditions are because of bone marrow failure and it is leading to the impaired RBC production. The third category is because of impaired erythropoietin production. So again the RBC production is impaired because of impaired erythropoietin production. The conditions include chronic renal failure which leads to anemia, hypothyroidism and hypopituitarism, so that also leads to impaired erythropoietin production, and chronic malnutrition. So these all leads to impaired erythropoietin production, in turn results in impaired RBC production. So these all conditions can lead to anemia. The second reason for anemia is disorders of increased RBC destruction. So this RBC destruction is named as hemolysis. So this hemolysis can be because of intrinsic factors and also extrinsic factors. So the hemolysis due to intrinsic factors, the factors which are inherited or inherent inside our body. So abnormal hemoglobin synthesis, for example thalassemia, sickle cell disease, then enzymatic defects like glucose 6-phosphate dehydrogenase deficiency, abnormalities in RBC membrane or structural defects of RBC like hereditary spherocytosis. So these are some of the intrinsic factors which leads to hemolysis, and that is leading to RBC destruction or hemolysis and finally end up with anemia. The second condition, that is hemolysis due to extrinsic factors. So some factors from outside our body which is resulting in hemolysis inside our body. So the infections like malaria, Kala-Azar, these can lead to hemolysis and anemia. Antibody reactions, that can be Rh or ABO, isoimmunization, lupus erythematosus, these all can lead to hemolysis. Next is the drugs like phenytoin, primaquine, these also will lead to hemolysis. Next is a poisoning, that is lead poisoning. Especially in children, there is increased risk of getting lead poisoning, burns and splenomegaly. So these are the extrinsic factors and results in hemolysis and which is leading to anemia. So this is the first classification of anemia based on the etiological factors and the morphology. The classification 2, it can be classified again depending upon the lab values like mild, moderate or severe enough to lead to life-threatening complications. So mild mild anemia is less than 10 gram percentage, but it is normal for the less than normal for the age. So what is normal for that particular age, that we have to consider, and if it is just less than that, it is a mild hemoglobin, mild anemia. Next is moderate, that is 7 to 10 gram percentage, and severe less than 7 gram percentage, and very severe if it is less than 5 gram percentage. So that is a classification of anemia. The second classification, depending upon the severity of reduction in the hemoglobin concentration.